Let's examine the structure and complications of lung abscesses. So here we have an airway or a bronchus. Here we've got the pleural surface, the lining of the lung, and here is the chest wall. So here we have a lung abscess filled with pus and with a pink border of fibrin around it. External to the abscess is a zone of acute inflammation. Now, pus inside abscesses tends to burrow through tissues enzymatically, and it can then empty the pus onto a natural surface. So in this case, the natural surface is the bronchus or airway. So we now have an abnormal connection between a lesion, the abscess, and a natural surface, and this is known as a sinus. And this sinus can allow pus to drain out from the abscess into the airway, which can then be coughed out, and it allows air from the airway to enter the abscess, forming an air fluid level. Another sinus could form from the abscess to the pleural cavity, and this allows pus to enter the pleural cavity. And pus filling a hollow organ or cavity is known as an empyema, in this case an empyema thoracis. We now have sinuses connecting to two natural surfaces, which causes an abnormal communication between those natural surfaces, and that's known as a fistula, in this case a bronchopleural fistula. And this fistula has resulted in both pus and air entering the thoracic cavity. So this is called a pneumothorax. It's helpful to think about all of these possibilities when thinking about the complications of lung abscesses.